Hi, I'm Oyatewa Asemba. I am a dermatologist currently located in Houston, Texas, although I'll be moving to Dallas soon. And here at Elevate, I have 3 lectures today. 2 are about hair loss. One is complex cases. One is about styling and taking care of hair in patients with hair loss. And then one is about pigmentary disorders, how to identify them and how to treat them. So I think I kind of touched on it a little bit, but I think the most common mistakes are not touching the scalp. That is the biggest one. And you will be shocked at how often my patients say that they felt like they were dirty or disgusting by their previous provider. So I think that's the biggest thing. I actually think that most people aren't doing it because they think that. It's probably because they just don't know, like, am I gonna mess up the style or, but if a patient has come to you for hair loss, they are expecting you to get in there. And actually, if they weren't expecting it, then you should tell them, hey, I think we should have you come back with your hair loose and ready for me, right? Sometimes patients come in with extensions or with something where you can't actually see the scalp, and it really helps you build rapport with the patient when you say like, hey, I need to look at your entire scalp. So I would love for you to come back when I can really access the entire scalp. So I think that's probably the biggest mistake that people make. The second biggest mistake that people make is assuming that giving a shampoo that a patient's gonna use multiple times a week is gonna be an effective treatment. I explained in one of my lectures today that not only do curly and coily hair patients not need to wash every day, but they should not wash every day because it will cause breakage for their hair, right? Whereas straighter and wavier hair types need more frequent washing because sebum, your body's natural conditioner, really coats the hair and attracts dirt and dust. For coily and curly hair, it's really hard for sebum to get down there. So we have to add things that are fake sebum like conditioners and oils to give the hair some of that moisture. So washing too frequently removes that. And so explaining that and helping people understand that the washing frequency is different and should be different can be very helpful. Yeah, I think it's deeply important, right? Because you can make a recommendation, but if it's not going to work with the patient's lifestyle. So I think a great example is one of my favorite treatments these days, Roflumilast 0.3% foam, which has been a game changer for seborrheic dermatitis and for inflammatory disorders, is a water-based foam. So even though it's one of my favorites and it works for, I'd say, like 85% of my patients, if a person with curly hair has thermally straightened hair, meaning that they went and got a blowout or they got it silk pressed, right? A water-based treatment can revert their hair back to its natural texture. If someone paid $400 for their special blowout, they might be very upset with you for giving them a water-based treatment. So you really want to ask them how they typically wear their hair so that you're picking a vehicle that works with their typical hairstyle. It's devastating for a lot of people, and it's actually more devastating than the diseases that cause it. Sometimes if it's post-inflammatory, it's just devastating, and it makes people feel like they're not themselves. I think it can be very difficult. I do like to ask about quality of life, but it can be quite difficult because we're not always able to get them 100% back to baseline, right? So really, I tell providers to always focus on treating hyperpigmentation at the same time as inflammation. So a common mistake people make is telling patients, hey, let's treat the acne first and then we'll treat the hyperpigmentation. Instead, I'm always telling my patients, hey, if you have acne, I know it's gonna cause hyperpigmentation, so we should already be doing some things for your pigment now as we're treating the acne. That builds rapport with the patients and also helps to prevent some of that PIH, right? So it's harder for the primary hyperpigmentation disorders that are not post-inflammatory because they show up as dark spots, right? So it's tougher, but.